Bismillahirrahmanirrahim. Today we will discuss the stridor and its management. Stridor is the noise made by air being forced through the narrowed upper airways. The typical characteristic sound and associated features are seen when there is stenosis in the supraglottic, glottic, subglottic, or tracheal level. Stridor is a symptom, not a disease itself. Thus, further investigation is needed to identify the underlying cause producing stridor. Any obstruction above these mentioned levels, that is, supraglottic, glottic, subglottic, or trachea, they will cause a stutter sound. On the other hand, obstruction at the level of bronchi or below will cause a wheeze. Important causes of stridor. The stridor may be acute stridor or it may be chronic stridor for a long period. The causes which cause acute stridor are foreign body inhalation, acute epiglottitis, laryngotracheobronchitis, laryngitis, especially acute laryngitis, anaphylaxis, neck space abscesses. Then the causes which may lead to chronic stridor are laryngomalacia, subglottic stenosis, vocal cord paralysis, subglottic hemangioma, respiratory papillomatosis, macroglossia, or micronathia. Malignancy of larynx also lead to a chronic stridor. The timing of stridor during inspiration expiration can be used to identify the likely region of airway affected. Inspiratory stridor suggests a laryngeal obstruction, whereas expiratory stridor suggests tracheobronchial obstruction. If the stridor is biphasic, stridor both in inspiratory and expiratory phases of respiration, then it will suggest a subglottic or glottic anomaly. Stridor has to be differentiated from stutter and wheeze. Stutter is a low-pitched snoring sound resulting from stenosis between the nasopharynx to supraglottic regions, whereas wheeze is a polyphonic expiratory airway sound caused by lower airway narrowing at the level of bronchi or below it. These are the three regions: supraglottis, glottis, and subglottis, which are the sites of stridor. Red flags are warning signs regarding stridor. Stridor itself is a red flag sign. Therefore, investigation and management must be started urgently. If not done, then the patient may not be saved. If the volume of the stridor sound decreases, it means that the patient is becoming tired and less air is being shifted by the lungs. Important signs to assess in all cases of stridor include torticollis and trismus, inability to swallow and drooling, absence of cough, cyanosis, evidence of systemic infection, or poor response to initial management. Investigations and management. In most emergency situations, the diagnosis is a clinical one. Initial management steps should be initiated before the results of the investigations are back. Definitive management steps will depend on the underlying cause. For non-emergency or chronic cases, visualization of the upper airway will normally be done by fiber optic nasal endoscopy as a quick and minimally invasive means to differentiate where the pathology lies. Further imaging studies such as CT scanning can be used in cases of abscess or malignancy. Bronchoscopy can be used if visualization below the vocal cords is needed, such as suspected subglottic stenosis. Any form of airway examination should be avoided in cases of suspected epiglottitis or croup, as this can predispose to sudden airway closure and death of the patient. Acute management. For acute causes that require urgent management, initial steps should involve: number one, stabilize the patient; number two, start high flow oxygen; and number three, alert suitable senior specialists, for example, ENT specialist and anesthetists. Number four, try to suck secretions or clear any foreign body from the airway if obvious or visible. Number five, give adrenaline or steroids through parenteral route or through inhalations as necessary. And number six, take bloods, including an arterial blood gases or cultures if indicated. In emergency situations, be prepared to perform an emergency cricothyrotomy or emergency tracheostomy or intubation if required. And the further management includes: find out the cause causing stridor and treat the patient accordingly. Thank you very much.